Okay, today we're going to be talking more about stretching. So let's get started. First, let's talk about what you might stretch here. So, looking at this picture of someone who has an anterior pelvic tilt with an exaggerated lumbar curve, what muscles do you think we will be stretching or need stretching here? So, pause this video, come up with some muscles that you think need stretching. So hopefully you pause, you're back now, and you've come up with the hip flexors, iliopsoas, rectus femoris, the erector spinae, and the latissimus dorsi. So hopefully you've come up with all of those. If we see here in this picture, our erector spinae are going to be tight since the hip is in flexion. The hip flexors are going to be tight. So we're going to really be focusing on stretching out those hip flexors, stretching out the erector spinae, latissimus dorsi. So now what I want you to do is pause here and try to come up with a couple stretches that may target those muscles. So hopefully you came up with some of these. So this stretch here at the top is for our hip flexor stretch. This back leg being an extension will stretch out those hip flexors. This one here with this gentleman in the fetal position is stretching out that erector spinae. This one here is for latissimus dorsi in this prayer pose. And this one is a Thomas test stretch, which we talked about in lab class. Remember, a positive for Thomas test is if the femur is not on the table or off the table, that would mean a tight iliopsoas. And if the knee is not relaxed and bent to 90 degrees, then that's a positive tightness for rectus femoris. So if we look at this picture here, this therapist here is stretching both hip flexors and rectus femoris. So he's stretching hip flexors by pushing down on this on the knee here or on the femur, and then he's stretching rectus femoris by using his foot here to bend the knee more into flexion to stretch rectus femoris. So this is a great way to target both rectus femoris and iliopsoas. So what I want you to remember here is the difference between joint and muscle stretching. So if I say hip flexion versus hip flexors, hip flexion, remember, is the joint. Hip flexors are the muscle. So when I'm thinking joint stretching, hip flexion, I want to think where my hands need to go to push them further into that motion. My hands don't change, just my cueing changes for each PNF stretch technique. Same here. If I said wrist flexors, that means muscle, right? Flexors means muscle. So then I want to ask myself, is this a two joint muscle? If the answer is yes, I want to remember where that muscle is, which is down here, and I need to set and forget the middle joint to elongate that. Because if we think about the wrist flexors, they cross the wrist and they cross the elbow. So in order to elongate that, I need to keep the elbow straight. So right now, this lady is stretching her wrist flexors. If I wanted to stretch wrist extension, she would just need to bend the elbow here, and then she'd be pushing more into wrist extension. And elbow bent, that would be stretching wrist extension joint. So a good thing to think about when you're stretching a muscle is you need to think of it as a two joint muscle, and if it is, we need to set and forget the middle joint. And then we also need to think about how am I going to elongate that muscle. And I'll give you a hint. It's usually opposite of what that muscle does. So right here, if you think about it, we're stretching the wrist flexors. So she put herself into wrist extension, opposite of what that muscle is named after or what that muscle does. Next here, I want you to read these goals and think about how you would target each of these goals with a stretch. So pause here, read through them, and then think, How would I target this goal and what stretch would I give my patient? Hopefully you came up with some of these. So that patient that was lacking side bending, could give them an upper trap stretch like this. Hold for 30 seconds and we'll be stretching the upper trap there. Our patient that's lacking knee flexion, this is a great stretch. He could pull on this until he feels tension in the joint, knee flexion, joint, and then he can hold this for 30 seconds. Our patient is struggling to reach the whiteboard. Shoulder flexion would be what we are lacking there. So we would have her go up a wall until she feels tension in the shoulder joint and hold that for 30 seconds. And then our patient with the rounded shoulders here could do this corner pec stretch. To think about rounded shoulders, that's making pec shortened and tight. So this would be a great stretch for our rounded shoulders patient. So hopefully you were able to come up with some of those. Okay, let's talk about the GTO, the Golgi tendon organ right now. So this is a mechanism that's built into our tendons. Remember, muscle attaches to tendon, tendon attaches to bone. So this is actually triggered by a contraction or tension of that tendon. So a contraction, which then that Golgi tendon sends a signal up to the spinal cord, which then tells the body to relax. So what is this really using? It's using autogenic inhibition, which really just means with contraction comes relaxation. So we're going to use this in some of our PNF techniques that I'm going to be talking about here shortly. We also have built into our muscles something called the muscle spindle. And what this is triggered by is a quick stretch. And so when that quick stretch happens of our muscle, you can see deep in our muscle here, this muscle spindle sends a signal up to the spinal cord, which then makes your muscle contract, which is a protection mechanism. Okay, let's talk a little bit about contract relax, our first PNF technique. So this is using the GTO, really, and what it's doing is we're having the muscle contract that we're stretching so that we can use that GTO to make it relax. So what we do with this one is you're going to push them further into that stretch. So if it's a joint, we're going to push them further into that motion. So hip flexion, going to push them further into hip flexion. I'm going to check in, make sure they feel some tension in that joint. Once they do, I'm going to have them push into me isometrically and count out loud to 10. Once they do that, I'm going to tell them to relax, and then me as the clinician, I'm going to move them further into that stretch and hold them for 10 seconds, check in for feedback, make sure they're feeling that stretch, and then repeat that process 2 to 3 times. Our reciprocal inhibition or our agonist contract technique, this is really just using reciprocal inhibition to our benefit. So what is this? What's reciprocal inhibition? It's just basically saying when the agonist contracts, the antagonist relaxes. So like this picture here, when biceps contract, triceps relax. And we're going to use this to our benefit with this technique. So what are we going to do? Let's say that I'm giving you wrist flexion. Okay, so joint or muscle is what you're going to ask yourself. Hopefully you told yourself joint here. So then I'm going to keep that elbow bent, because it's not a 2-joint muscle anymore, it's the joint. We're going to keep the elbow bent. We're going to put them more into wrist flexion. And then we are going to make sure they feel that mild tension in the joint. Once they do, we are going to ask them to move themselves further into wrist flexion. We as the PTA follow, hold that new range, make sure you hold for 10 to 15 seconds, checking in, making sure they're still feeling that stretch. And then we would repeat that 2 to 3 times. So what are we doing? We're using our reciprocal inhibition to relax the muscle that we're stretching. Next, our combo. This, or also known as contract relax and agonist contract, or our crack technique. And this is combining our contract relaxed and our reciprocal inhibition together. So let's say that we're doing wrist flexion again, okay? So it's a joint. We're going to keep the elbow bent. We're going to push our patient's wrist into more flexion until they feel tension in the joint. Once they do, we're going to have them push into us, counting out loud to 10, doing an isometric contraction. Once they do that, we're going to tell them to relax, and then we're going to ask them to move further into wrist flexion. We're going to follow. We're going to hold that for a few seconds and repeat that 2 to 3 times. And that is the combo technique. Next, I have listed out some stretching precautions, some things to think about when we're stretching. I'm just going to review some of the most important ones, I would say. So avoiding overstretching weak muscles. Weak muscles are already lengthened. So we don't want to overstretch those because they're typically already lengthened. So that's something we need to consider. Another thing we need to consider is we need to be using caution with our patients that have osteoporosis. We already know those bones are brittle, and we know that muscle attaches to bone, and we don't want to be pulling on those muscles causing bone injuries. We need to protect any newly fractures. So we typically don't do this on a new fracture site, and definitely we need to stabilize between the fracture site and the joint that is moving for the stretch. We also need to remember that we need to avoid static stretching immediately before activities that require explosive power, including any sports activities. So that's why you see a lot of athletes when they're stretching before an event, they're doing a lot of ballistic stretching. So a lot of fast kind of stretching, moving in and out of the stretch fast, keeping those muscles warmed up. And then another big thing we need to remember that we need to do while we're stretching these patients is look for compensation. So anything that is looking out of whack while you're stretching usually means that's the patient trying to compensate for the stretch. So a perfect example of this is with our hamstrings, a pelvis tilt, or the knee bending would be a compensation there. So really checking for compensation, and we really don't want to force a stretch beyond that mild to moderate tension. We don't want to injure our patients when stretching. So that is my stretching lecture. Now, after you watch this, you're going to go answer the questions and turn it into Canvas. Hope you enjoyed. Have a great rest of your day.